My question is to the Minister representing the Health Minister, Minister Gallagher. Minister, in November 2022, I raised with you the issue of excess mortality as reported by the Australian Bureau of Statistics. Now, the most recent full report from the ABS shows that for the first 9 months of 2022, there were nearly 20,000 excess deaths, which is about 16% more than the baseline average. Now, of those, 8,160 deaths were attributed to COVID-19. So where's the rest from? Now, Minister, can you please confirm if the Department of Health has investigated this large increase in excess mortality? And if they have, can you advise the Senate what is causing this spike in deaths?
Thank you, Senator Babet. Minister Gallagher.
Thank you, President. I thank Senator Babet for the question and also for the advance indication that he would be asking a question around excess deaths. I can say that the Department of Health would, as routine, look at the reports that come out through the ABS. As the Senator indicated in his question, the reports that the ABS does into mortality statistics, the reports they do on the causes of death, and of course the Department of Health would look at those and examine those to see if there are any trends or issues of concern. I think I'm advised that it's important to note that increases in deaths from a range of other causes not related to COVID-19, because there is an indication of excess deaths related to COVID-19, have also been observed in 2022, and examples include deaths due to dementia, including Alzheimer's disease, which were 25.6% above the baseline average in June and 21.8% above the baseline average for the year to June. And while the number of COVID-19 cases and associated deaths has increased in 2022, I think it is important to understand that the proportion of COVID-19 associated deaths relative to the numbers of cases of COVID-19 has decreased overall, which highlights the positive impact of the health measures, of the changes in transmission, the vaccination and the reduced severity of the Omicron variant and subvariants when compared to earlier COVID-19 variants such as Delta.
Thank you, Minister. Now, you mentioned some causes of death there, but you didn't mention myocarditis and pericarditis. Now, this is an issue which is now in the mainstream media. Even Karl Stefanovic talked about it on Channel 9 recently. He said he wouldn't take more than 2 jabs because he had concerns relating to heart issues. Now, Minister, is the government confident that none of this is because of the mRNA injection?
Minister.
President, I thank Senator Babet for this supplementary. I would say that COVID-19 as a virus also impacts the health and has those health consequences. So pericarditis, myocarditis is also, if you have a bad case, a severe case of COVID-19, that is a side effect, a consequence of that. And I would also say that the data shows that for those who are unvaccinated, so haven't had a vaccine, primarily an mRNA vaccine, they are much more likely to end up in ICU or passing away. So those who are not vaccinated or not up to date with their vaccination, and for people in my age group, it's 32 times more likely to end up in hospital if you're not vaccinated. So the answer to the question is yes, we are confident. The government and the approving authorities are confident that the mRNA vaccine is safe, and we urge people to be vaccinated.
Senator Babet, second supplementary.
Thank you, President. Now, Minister, given that you're so confident—
Order! Order!
Minister, given that you're so confident that mRNA is so safe and is so effective, when is the government going to release the data to support this claim? When are you going to talk to ATAGI and tell them to give us the information? Are you going to do this, Minister?
Thank you, Senator Babet, Minister.
Thank you. And I would say the safety of the vaccine is whilst ATAGI has a role about the provision of the vaccine, who should be provided the dose, the approving authority is the TGA, and they do publish adverse events through quite frequent reporting. I think it's either weekly or monthly reporting of adverse events relating to vaccination status. I would also say that, of course, people are entitled to get advice from their health professional about whether the vaccine is safe for them and take that advice. But I would also urge people, with the 5th dose becoming available, to please remain up to date with your vaccinations. It's not just an individual decision. This is the thing. It's not just about an individual's decision and keeping yourself safe. It's keeping other people safe from this virus, people who aren't able to be as protected as some of us. So it's actually a community responsibility to be vaccinated.